Good morning, everybody. Hispanic Americans are 1.5 times more likely to develop Alzheimer's or other forms of dementia than white Americans. That's according to data from the Alzheimer's Association.
We have Brittany Flowers here now with how one doctor in West Michigan is working to help patients who speak Spanish. Good morning.
Good morning. In addition to higher rates of Alzheimer's and dementia, Latino populations tend to have a delayed diagnosis. That's why Carlos Rodriguez, a neuropsychologist at Corewell Health, is working to address these barriers.
There's a lot to navigate for families as they're trying to figure out or understand what's going on to their family member.
When Carlos Rodriguez first came to Grand Rapids, he noticed a major lack in Spanish neuropsychology services.
A lot of our tests that have been designed in neuropsychology were developed, standardized, normed in English-speaking populations.
Because there is already a stigma associated with memory loss, Rodriguez says it's vital to ensure non-English speakers are kept in mind when testing abilities like memory, language, and thinking.
There's a really big impact on the Latino community with this condition. I think there's a lot of barriers to care, so it's complicated.
Rodriguez is the only bilingual neuropsychologist in West Michigan. Every Monday and Wednesday, he hosts a clinic specifically for Spanish speakers.
After we complete an interview, then we'll get started with the actual testing process. And it's things like showing people a picture of something and they might have to remember it later on, or I tell them some verbal information that they'll have to remember later on, or I give them a puzzle to work with and I time how quickly they can complete that puzzle.
Depending on the outcome, Rodriguez then recommends a treatment plan.
It might be talking about medications, it might be talking about modifying the environment, it might be talking about referring to other subspecialties.
Regardless of the diagnosis, he says patients and their families always seem relieved to have a provider who understands them. His hope to continue providing this service for an often overlooked population.
As long as there's a need, I want to be there, and I also want to train other folks in my field too, so that there can be more providers available to provide this service too.
Rodriguez sees between 2 and 3 patients every week. He says the wait list to get into his clinic is a few months, which is typically pretty good for that sort of service. He's also looking to eventually hire Spanish-speaking psychometrists to help out with his clinic as well. In studio, Brittany Flowers, News 8.
Yeah.